Thank you, Deputy Speaker. I do now rise to speak on this motion that's been brought by the member for Jagga regarding the aged care sector. Deputy Speaker, all Australians want and expect our older Australians to be well supported and cared for in our community, including and I suppose particularly in residential aged care homes. The opposition remains committed to supporting the health, safety and wellbeing of older Australians and understands the important role that healthcare providers, care workers and nurses play in ensuring this support is provided in residential aged care settings. And I was listening to the honourable member talking about her experiences with her grandparents. And, Deputy Speaker, I can even remember being taken to see my great-grandmother many, many years ago, and at that stage it was in a facility in Sydney, and it was in a room. She was in one room with seven other women, and they were sort of taken out of a bed each morning and put on a chair and left there for the entire day. So it is. I was a very, very little girl at the time, but I still have that visual. So I am most relieved that these days we are providing technology, and our understanding of aged care has moved on, so that we are no longer treating our elderly as if they are patients in a hospital. I think is probably the best way of putting it. I had, and then a long time after that, I had my mother's mum, my nana was also in an aged care facility towards the end of her life, and she did receive very good care. But I could see firsthand there the experiences of the aged care workers and how under-resourced and overworked they are. Deputy Speaker, in my electorate of Hughes, I have over 15 aged care facilities, and that offer just over 1,600 residential places. And I just take this opportunity to thank everybody within my electorate who works within the aged care sector, whether they be the doctors or the nurses or the cleaners or the cooks or the helpers, and particularly acknowledging those who are working in the high needs, some of the higher needs facilities, particularly in dementia and Alzheimer wards, the work that they are doing in those wards in those facilities to provide quality of life to our elderly in their last stage, to provide them with stimulation, activities, and to keep them engaged is phenomenal work. And particularly, I recently visited at Hammond Care over at Hammondville. I've also recently been to St Vincent's Care Services in Heathcote, as well as Thomas Holt in Kirrawee, and Catholic Healthcare Percy Miles Villa at Kirrawee. And so again, I say thank you to everybody, particularly in my electorate, who are working in those facilities. The Albanese Labor government has sought to act on some of the recommendations that have come out of the Royal Commission into aged care, and there were some fairly shocking findings that came out of that. Unfortunately, the government, the minister particularly, while she said she'd put the care back into aged care, instead, Deputy Speaker, we have had a number of aged care homes close under the minister's watch, and in particular one very close to me, just outside of my electorate in Sylvania, Wesley Mission, where many of my electorate do or were living in that, had initially lived in my electorate and then had moved in there. So I think that there is still far more work that the government needs to do and that the minister needs to do. The policy of having a 24/7 nurse in every facility is a beautiful dream. It is aspirational, but it simply has not worked, and we've seen that with the closure of these facilities, amongst other things. So, Deputy Speaker, again, I commend all of those in the aged care sector. Thank you.